Hi, I'm Dr. Stephen Rabin. I'm a board-certified obstetrician gynecologist here in Atlanta, and I've been working here since 1993. In 2007, I stopped delivering babies so that I could focus on gynecology only. I provide general gynecology services in my practice, which includes annual exams, managing abnormal pap smears. We also do minor procedures and all the way up to major operations in the hospital. And while I do all of these general gynecology practices, I specialize in three particular areas that I'd like to talk to you about today. My first area of expertise is in birth control management, and there's a new procedure I'd like to tell you about called the e-Sure. It's an alternative to traditional tubal sterilization. When we do a tubal ligation, we usually go to the hospital. You have to go under general anesthesia, spend almost half the day there, and have one or two incisions in your abdomen. When we do the e-Sure procedure, it's done in the office. You take a few pain pills before you come in. We use a Novocaine-type substance to numb the cervix, and we go inside the uterus and block the tubes from the inside. It's 99.8% effective, which is as good or better than a tubal. And we do a procedure 3 months later. It's an X-ray to see that the tubes are actually blocked. This gives you the assurance that the e-Sure has been complete and that you can rely on it for birth control. The second area that I take a particular interest in is managing heavy menstrual periods. Now, the first thing that has to be done is to get an accurate diagnosis. And we do this with ultrasound. Sometimes we do an endometrial biopsy and even a saline-enhanced ultrasound that gives us an idea about the contour of the inside of the uterus. Once we know the cause of your abnormal bleeding, we're able to offer you the right option for you. One of those options avoids hysterectomy, and that's called an endometrial ablation. And again, in the office with just some numbing medication, we're able to treat just the lining of the uterus. And this gives you an 85% chance of either eliminating your menstrual period or at least reducing it to something normal. The third area that I'm most excited to tell you about is bioidentical hormones. Hormone imbalance can happen at all stages in a woman's life cycle, from adolescence to before and after pregnancy, and then in the premenopause, during the transition, and certainly on through in the menopausal time frame. What bioidentical hormones do is give women an option to replace the exact hormones that she once made. Instead of using synthetic products or products that are absolutely not ever found in the human body, we're able to provide molecules that are exact replicas of estradiol, progesterone, and testosterone, and balance these in a safe, low-dose way to provide relief of the symptoms of hormone imbalance.